Hyperlipidemia is well known as high cholesterol and is the increased levels of lipids in the blood. Hyperlipidemia is treatable, but it is often a lifelong condition. Hyperlipidemia often leads to the risk of coronary artery disease. The two main lipids found in the blood are cholesterol and triglycerides, which build up in the walls of arteries that increase the risk of hardening the arteries. Hyperlipidemia itself doesn't have any symptoms, but if it results in coronary artery disease or atherosclerosis, then some symptoms may develop. These include chest pain, high blood pressure, and stroke, to name a few. As stated already, hyperlipidemia itself doesn't have any symptoms, but if it is suspected, then testing such as a lipid panel or lipid profile is performed. This consists of a sample of blood taken that is sent to the lab to determine cholesterol levels. Total cholesterol, LDLs, which is known as bad cholesterol, HDLs, which is known as good cholesterol, and triglycerides. If hyperlipidemia turns into atherosclerosis, plaques develop on the walls of arteries and blood vessels that narrow the openings of the vessels, causing complications. Hyperlipidemia has several contributing factors, some of which that can be controlled and some that cannot. Here are some examples of lifestyle choices that when it can be controlled. Avoiding food high in fats, some meat and dairy products, not exercising, obesity, having a large waist circumference, smoking, and consuming lots of alcohol. Here are some foods that contain cholesterol and fats to avoid or decrease that amount consumed. These include cheese, egg yolks, fried and processed foods, ice cream, pastries, and red meats. There are also risk factors that can't be controlled, such as having a family medical history of these illnesses, which include kidney disease, diabetes, and polycystic ovary syndrome. Being pregnant or having an underactive thyroid can also produce a large risk. Hyperlipidemia can be inherited, which of course is out of our control, but having the knowledge of what can be controlled can help decrease the chances of it turning into coronary artery disease or atherosclerosis. As the risks continue, taking birth control pills, diuretics, or depression medications can also increase the risk of having hyperlipidemia. If you haven't been diagnosed with hyperlipidemia or haven't had a lipid panel taken, it is encouraged to do so every 2 years after the age of 20. Also, being aware of things that can increase the risk of hyperlipidemia can be helpful knowledge in knowing what to avoid. There are several medications that are used to treat hyperlipidemia. They're known as anti-hyperlipidemic agents. There's mounting evidence that the incidence of coronary artery disease is the leading killer in adults in the Western world, and it is higher among people with high serum lipid levels. The cause of coronary artery disease is poorly understood, but some evidence indicates that cholesterol and fat may play a major role in disease development. Anti-hyperlipidemic agents such as bile acid sequestrants, HMG, CoA inhibitors, fibrates, niacin, or cholesterol absorption inhibitors may be used. These drugs are often used in combination and should be part of an overall healthcare regimen that includes exercise, dietary restrictions, and lifestyle changes. You can see the list of medications that I've compiled here for this disease. Rosuvastatin reaches higher serum levels in Asian Americans than in any other populations. It is recommended that this drug can be reserved for use in non-Asian patients. Some important things to remember when administering bile acid sequestrants include: the patient will have limited adverse effects to drug therapy. Administer these drugs before meals to ensure the drug makes it to the GI tract with food. If the patient is taking these in tablets, do not cut, crush, or chew the tablets. They're designed to be broken down in the GI tract, and if they're crushed, they will not be effective. Encourage the patient to drink lots of fluids when taking these medications. Administer the patient's other drugs an hour before or 4 to 6 hours after to avoid drug-to-drug interactions. It is also important to monitor the patient's response to the drug by seeing a reduction of serum cholesterol levels. Monitor for headache, constipation, nausea, and rash. Here are some more medications that can be used for hyperlipidemia: fibrates, vitamin B, and omega-3 fatty acids, to name a few. Adverse effects for all anti-hyperlipidemic medications are associated with the use of the drugs include headache, anxiety, fatigue, drowsiness, which could be related to changes in serum cholesterol levels. Direct GI irritation, including nausea, constipation that may progress to fecal impaction, and aggravation of hemorrhoids may occur. Other effects include increased bleeding times related to a decreased absorption of vitamin K and consequent decreased production of clotting factors. Vitamin A and D deficiencies are related to decreased absorption of fat-soluble vitamins, rash, and muscle aches and pains. So here's a list of resources that I used to compile all my information for the presentation. And now I would have an interactive session with the class, and I'll probably play a game such as Kahoot because it's fun, interactive, and most people like it because it can be a little bit of a competition, and I'll probably give some prizes as well. So I just compiled a list of the question and answer. This will probably take 4 to 5 minutes as a class interaction activity. So the first question I have compiled is, what is hyperlipidemia? I have A, obesity, B, low cholesterol, C, high blood pressure, and D, high cholesterol. So for the rationale, answer D is correct. A is a risk factor for hyperlipidemia, B is referred to as hypolipidemia, and C is referred to as hypertension. So 2, what lipids show on a lipid panel or lipid profile? Select all that apply. I have A, total cholesterol, B, TDL, C, LDL, and D, HDL. So I'll give the class time to answer. Okay, and I would have A, C, and D are all correct. B is incorrect because it doesn't exist. TDLs is just something I made up. So 3, true or false, hyperlipidemia is treatable. So I'd give the class time to answer. And the answer is true. However, it is usually a lifelong condition. So 4, hyperlipidemia can be prevented by A, eating more fat, B, drinking more alcohol, C, increasing the amount of exercise, and D, smoking. So I'll give the class time to answer. And C is the correct answer. A is wrong because eating more fat would increase the risk of having hyperlipidemia. B is incorrect because consuming more alcohol would increase the risk. And D is also incorrect because it's another risk of hyperlipidemia. So again, that correct answer is C, increasing the amount of exercise. So then question 5, true or false, hyperlipidemia has no symptoms. So give the class time to answer. Okay, and the rationale is the answer is true. Unless it develops into coronary artery disease or atherosclerosis, there are no symptoms. So at this time, I would make sure that the class doesn't have any questions. If they do, I would answer those to the best of my ability, and that'd be it. Thank you.